Welcome to Tama Talks Tox. I'm Tama, nurse practitioner in aesthetic medicine. Have you ever looked in the mirror and you see that you're super tired, but yet you had a great night's sleep and you have plenty of rest? Well, I have a solution for you. It's my honor and privilege to introduce you to Dr. Vrcek. He's a board-certified ocular plastic surgeon in Dallas, Texas. His specialty is the eyes and the orbit. Welcome, Dr. Vrcek. Thank you for coming.
Thanks so much, Tama. Yeah, I'm Ivan Vrcek. I'm an oculoplastic surgeon. I perform plastic and reconstructive surgery around the eye to include eye bags, droopy eyelids, other reconstructive procedures around the eyes, and I'm happy to be here.
So what's the difference between ocular plastic surgeon and a plastic surgeon?
Sure. So there are different kind of roads to performing plastic or aesthetic surgery on the face. Many patients are familiar with a general plastic surgeon who might perform breast lift, breast augmentation, tummy tucks. These people start off as general surgeons, and they do advanced training in plastic surgery. There's also ENT facial plastic surgeons. So they start off as ear, nose, and throat doctors, do advanced training in facial plastic surgery, and they're great at rhinoplasty and other aesthetic procedures on the face like facelift. Oculoplastic surgeons like myself, we all start off as board-certified ophthalmologists. So we go to medical school and then ophthalmology residency doing surgery on the eyeball. So like cataract, LASIK, these types of things. And then a small number of us go on to do accredited fellowships in oculoplastic surgery. There's about 25 or so in the country. It's a 2-year fellowship of intensive training in plastic and reconstructive surgery of the eyelids, orbit, and face. So a lot of oculoplastic surgeons also do facelifts and these sort of more extended facial surgeries. I focus my practice on the eyes, mostly upper eyelid, lower eyelid, brow.
I see. I read your bio. It was quite impressive.
Thank you.
Yeah. So, I know that your philosophy is about natural results. So, in aesthetic medicine, we rejuvenate with filler, the temples, the tear trough, the brow bone. And we use devices, too, to tighten and lift and even PDO threads. But we can't take away skin or take away tissue, like, for example, festoon or malar mounds and things like that. We cannot camouflage with just filler alone. So the non-surgical options are no longer good for the patient. So we have to refer to surgical. It's a surgical intervention. And then, so tell me your philosophy about natural results and things like that.
Absolutely. Yeah, I think that's a great point. There are great non-surgical interventions, things like Botox and filler to replace lost volume. Aging is a process of volume loss, right? So if you think about a 9-year-old versus a 99-year-old, it's like a grape and a raisin, right? And so replacing volume can be helpful, but there's also gravitational descent. So you might need to lift something, or sun damage that causes changes to the skin that sometimes devices might be helpful for, but you might need to remove some if a device is not enough. And you're exactly right. My philosophy is all about restorative surgery. So I'm trying to recreate normal, natural anatomy. Think about it like trying to make yourself look like you did 10 years ago, not like a different person. So that's one reason, for example, rhinoplasty is great. I don't like rhinoplasty. The reason I don't perform rhinoplasty is about changing your nose. Blepharoplasty, in my mind, is about restoring the way your eyes used to look.
Right, to keep it awake and refresh.
Exactly. And I'll ask patients, send me a picture of you from 10 years ago, and let that be our goal, not a picture of a different person. And so, yeah, I'm trying to recreate normal anatomy with a restorative vision.
I was in the OR with you last week. I was so impressed. I got to see 4 surgeries. And I love the philosophy of leaving behind instead of taking away.
Yes, absolutely, totally. This is very important, particularly in upper eyelid surgery. So in upper eyelid surgery, you may remember you were watching me marking.
Yes.
So I was measuring and marking, and I wasn't measuring and marking what I was going to take away. I was measuring and marking what I was going to leave behind.
Right.
Because this is way more important. It's more important for closure. It's more important for symmetry. What you leave behind is more important than what you take away.
And then I saw one of the surgeries. It was the brow lift and the upper bleph together. So this is a comprehensive surgery for the upper face.
Yeah, exactly. Some people might even call that an upper face lift, a brow lift combined with an upper blepharoplasty. The type of brow lift you saw was an endoscopic brow lift. So it's a more advanced, minimally invasive technique that involves 4 small incisions that are hidden in the hair, as opposed to older techniques with larger incisions. This has these small, minimal access incisions. And again, we're recreating normal anatomy. So like we talked about before, aging is a process of gravitational descent. Gravity's strong, it's pulling our eyebrows down. And so lifting them back up, not to look like a fox or not to look like an unnatural appearance, but instead to restore where the brows used to be. And a minimally invasive brow lift like an endoscopic brow lift is a great option for that.
Yeah. And then let's talk about the lower bleph. I was fascinated with that because the skin pinch, and the repositioning of the fat. We know that as we age, the part of the fat becomes larger and it's no longer continuous. So I saw that you moved it more medially and then kind of sutured together. It was fascinating where the tear trough we mimic with filler in the clinic. So can you talk about that?
Thank you. Yeah, absolutely. So lower blepharoplasty is probably my favorite procedure to perform. Essentially, all of us have fat in the eye socket. There's a membrane that's supposed to hold it back. It's called the orbital septum. Over time, the orbital septum is getting loose, or sometimes you could even inherit a loose one and to develop bags in your 20s or 30s. As that membrane gets loose and the fat comes forward, it forms like a bulge. Beneath that bulge is a ligament called the orbicularis retaining ligament that causes like the tear trough or a hollow area beneath the bag. You can think about it kind of like a hill and a valley. And we want to shrink the hill and fill in the valley. And so what I do is I make a hidden incision on the backside or inside of the eyelid where you can't see it. That gives me access to where the fat is and where that ligament is. And I move the fat down into that ligament. Older techniques would just suck all the fat out.
Right.
Which again, like that can make things look hollow. It's not really restorative.
Right.
So newer techniques, we actually use the fat as a filler almost to kind of fill in that area.
So that's mimic someone when they're younger.
Exactly right. Exactly right. So that's called a fat repositioning lower blepharoplasty. And then like you said, we need a comprehensive approach. We need to address the skin as well. And so in that patient that you saw, I did a chemical peel to resurface the skin, and then I even removed some skin using a tiny incision hidden along the lash line. That's called a skin pinch. And in that way, we comprehensively rejuvenate or restore the appearance of the eyelid to how it was before.
Yeah, I really enjoyed that surgery.
I like it too.
Yeah, it was good. And then, I had my surgery with you 6 months ago. We did an upward blepharomy, and then we opened up the epicanthal slightly because I wanted to look Asian still, and I wanted to keep my eye shape, the almond shape. So can you speak on that, a little bit about the Asian eye, the monolid?
Totally, absolutely. So every eyelid is unique, right? And even within Asia, right? So you think about Asian eyelids, but within Asia there are differences. So like a Japanese eyelid might be different than a Vietnamese eyelid, for example. Japanese people have this classical monolid, and there are anatomic differences on the inside that are causing that. There's the orbital septum in the upper eyelid also, which is supposed to hold the fat back. The orbital septum insertion is closer to the lashes in a Japanese person than it is to me, which is what results in the crease of my eyelid being higher and the crease of a Japanese person being lower, very close to the lashes. And so we, again, want to restore or preserve natural anatomy. And that will impact where we put the incision. So, for example, in an Asian person, the crease is lower. So I measure exactly where is that crease, and I design the incision to fit into that crease. And then a lot of Asian people have an epicanthal fold. And so sometimes we want to soften that a little bit, but not remove it.
Right.
Just kind of soften it a little bit, and that's called an epicanthoplasty. And when I saw you just the other day, you mentioned to me, it looks even better now at 6 months than I did at 3 months.
Right.
And most patients are looking really good at 3 weeks, very good at 3 months, but it keeps getting better.
Right.
Full healing from any surgery can take a year or more. And I was really happy to see, you have beautiful natural results. I don't think anyone will look at you and say, like, you had your eyes done.
That's right. And that's what I wanted.
Yeah. Instead, people look at you, I think, and say, you look rested, you look refreshed.
More awake.
Yeah, exactly. This is the goal. Look like yourself, but a more rested, refreshed version.
That's good plastic surgery.
Thank you. I'm trying my best.
And then you guys were telling me about the hunter eyes.
Yes. This is really fascinating. This is kind of like a newer thing.
Right.
So a lot of men desire this more hunter eye appearance, which is a more vertically compact appearance. The opposite would be a doe eye. So you think about someone like Zooey Deschanel. She has big eyes. This is more like a doe eye appearance. She has a prominent eye, a big round opening. Whereas you think about a hunter eye as being a more narrow, sort of intense appearance. Deep set, exactly right.
The male models.
Yes,
like
right.
That. Yeah.
So to achieve that, there's different things that we can do. We can move the eye back a little bit. We can move the lower eyelid up a little bit to give this appearance of a more intense kind of hunter-ready kind of appearance and less tired, doe-ish kind of appearance.
Right. And in female, they can have hunter and doe eyes.
Yes,
both.
exactly right. So it's really what the patient wants, what their vision is, what we're trying to restore them to look like before, like we talked about. But yeah, each patient's unique. And it's really important. Probably the most important part of my job is not the cutting. The most important part of my job is the listening and trying to find out exactly what does the person want, understand what their anatomy, what they have coming to the table, what they want to achieve, and how anatomically we can get there.
Right. Ultimately, they want to be attracted to the opposite sex. That's why they want to look more virile, more masculine.
Yes, this is particularly important in the hunter eye appearance. It has to do a lot with being more attractive.
Yeah. And then let's talk about complications.
Sure.
You know, like you've had to help people with previous surgeries and things like that.
Sure, absolutely. So, I'm a specialist in eyelid surgery, and sometimes complications can happen really to anyone, but they're probably more common when you're having surgery with someone who's not maybe a specialist, right? Someone who kind of dabbles in eyelids and maybe gets into a situation they weren't prepared for, or something just unexpected happens. The most common complication I see in upper eyelid blepharoplasty is inability to close the eyes. And that happens when too much skin is taken away. Again, we talked about how it's important to measure what you leave behind.
Right.
And when that happens, it's often fixable, but it's complex. In the lower eyelid, the most common complication I see is where the lower eyelid gets pulled down
The
away
retraction.
from the eyelid. Exactly. That's called eyelid retraction. It can change the shape of your eye, make you look kind of sad. It can also cause functional problems like blurred vision and tearing. This is something that unfortunately I fix commonly. It's actually one of my favorite things to do, though, because when you, again, restore or put someone's eyelid back to how it was before, give them their face back from a complication that took their face away from them, this is a hugely gratifying thing for both me and for the patient. It's complex, but it's very rewarding.
Yeah, I've seen your before and after photos. They're amazing. And you have an Instagram, Dr. Vrcek.
Yeah.
Yeah, your photos are amazing.
Thanks so much. I'm trying my best.
Yeah, and then so let's see what else. Have we missed anything? Have we talked about everything?
Yeah, I think we talked about comprehensive facial rejuvenation in a restorative way, talked about upper and lower blepharoplasty, brow lifting. I think maybe you wanted to talk about like celebrity kind of. So there are some celebrities that have had maybe not the best work or work that they might not be proud of or someone else might not be proud of, or you see in the media like, oh, what happened to Simon Cowell? Or, oh, what happened to so-and-so?
Matt Damon recently,
Yeah,
his eyes.
sure. I get this question all the time, like these famous people in Hollywood, why are they not having natural results? It's hard to answer that question. But what I would say is that the most important thing is listening to the patient and trying to restore rather than change. And I think in general, if you have access to a specialist, go to a specialist. If you need a rhinoplasty, go to someone who's doing rhinoplasty all the time.
That's right.
If you need a lower face and neck lift, go to someone who's doing neck lifts all the time. If you need eye work, go to someone who's doing oculoplastic surgery all the time. And I think your likelihood of having these kind of uncanny results will go down. One thing, though, is, cameras are unfair, right? Like a 4K camera is going to pick up every little detail, and it takes time to heal from these surgeries. So sometimes some of these celebrities, they might not look great initially because it's only been a couple of weeks. Give it time, it'll get better,
Yeah, but it shouldn't be a couple of weeks. I was fine after 1 week.
Lucky you. I mean, I think that's awesome.
No,
I'm glad
so.
you had great results, and I'm glad you're lucky.
And so let's see. Complications with surgeries.
Yeah. So besides lower eyelid retraction, other things like infection, bleeding, scarring, these can happen really with any surgery. Infection is usually pretty preventable in eyelid surgery. Fortunately, eyelid surgery has a very low risk of infection, less than 1%. So low that we don't even usually give people like oral antibiotics after surgery, which is nice because it's just one less thing, one less GI upset type of problem. We usually use topical antibiotic ointments like you had on the stitches, right? Bleeding is a very uncommon risk as well. I use this medication called TXA during surgery to cut down on bleeding. I've published about it. It is super effective at cutting down on postoperative bruising, swelling, and bleeding. And so that's great, kind of reduce complications. We're always trying to advance surgery to make it safer, more predictable, less risks and complications.
So Dr. Vrcek, tell me about eye disorders like hypophthalmos and Graves' disease and things like that to where the eye is not really functioning anymore.
Absolutely. So I'm very passionate about cosmetic surgery. My other big passion is Graves' disease. Exophthalmos or proptosis, those are medical words to describe bulging eyes. So people with Graves' disease, it's a thyroid condition, they can develop bulging eyes. Some people just have bulgy eyes. That's sort of just how they're made, right? But people with Graves' disease, they're very bulgy. It can cause a lot of symptoms like tearing, redness, blurred vision, double vision. One of my favorite things to do is the rehabilitation of Graves' disease, because it's like giving someone their face back. The disease comes, it makes their eyes bulgy, it makes their eyes too open, it makes them uncomfortable, it makes them not look like themselves. And so restoring them back to how they looked before is a great way to make a happy patient. And so orbital decompression is the name for that surgery. Essentially, we make more room for the eye to sink back. This used to be a very morbid, like a very complex surgery that had a lot of complications. But like all surgery, it's kind of moving more and more towards minimally invasive techniques. So now when I'm performing orbital decompression, there's no skin incision at all. It's all done from the backside or inside of the eyelid. I make more room for the eyeball to sink in. It's a great procedure. It takes less than an hour. Patients are back to their normal lives usually in 4 days to a week. And it's very, again, restorative and confidence building.
Right.
Because people will tell me, I don't want to take my picture anymore because I don't look like me. I don't want to go outside because the sun's bothering my eyes. And you fix this, and in a matter of weeks, they're back to their normal lives, looking like themselves. This brings me a lot of joy, a lot of fulfillment, and it's great for patients, to have their face back. And so that's, after cosmetic surgery or with cosmetic surgery, that's probably my biggest passion, is Graves' disease and treating.
Because it's a functional thing.
Totally.
Now, with not just cosmetic.
Yes. It's kind of a great mix of function and cosmesis, because you're restoring the function, the eye back to the normal place, but also looking like yourself again.
Yeah.
So it's kind of a marriage of functional and cosmetic surgery, which I love. I also do other functional surgery, like I do skin cancer reconstruction and other kind of functional surgeries. I don't think I'll ever give that up. A lot of surgeons move totally cosmetic. I love a functional surgery. I love reconstructive surgery. I don't think I'll ever give it up.
Anything else you'd like to add?
Just thank you so much for having me here. I really enjoyed
Thank you so
talking to
much. Any of you guys want to see Dr. Vrcek? You have an Instagram, Dr. Vrcek?
You can reach me on Instagram. My last name is spelled Vrcek, which is kind of tricky. My family's from Croatia, and so it's sort of an odd name. But yeah, you can look me up on Instagram. There's not a lot of Vrceks out there. I also have a website that has the same last name in it. And yeah, happy to help you if you need something around the eyes.
And he does beautiful work. Look at me.
Thanks, Tama.
Thank you so much, Dr. Vrcek.
Thank you.